wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. I'm pleased to have as my guest Karen Ray, who's a nurse practitioner and specializing in regenerative joint therapy. She's located in Clearwater, Florida, and she's been in practice for 25 years, and in the last 10 years, she's dedicated herself to regenerative joint therapy. She has, on her own, treated over 50,000 patients with regenerative joint procedures. She's evaluated over 80,000. Of those, 50,000 needed regenerative joint procedure, and that's why I've invited her on the program to discuss that with us. Not only does she specialize in this treatment, but she also has set up conferences all over the country and trained over 3,500 practitioners, physicians and nurse practitioners and physician's assistants across the country in regenerative joint treatment. So that's why I wanted to bring her on the program, because as you're well aware, here at the Hotze Health and Wellness Center, we do regenerative joint therapy, and we learned it from Karen. I went to one of her conferences 5 years ago, and then we had her come into the office for a couple of days within the last year to help train our other providers in the procedure methods that she uses. So, Karen, welcome to the program today, and congratulations on your successes. I think it's tremendous what you've done, and I know you've helped literally tens of thousands of people escape the knife and not have to have their knees and hips amputated. So why don't you discuss with you how you got into regenerative joint therapy treatment, and what exactly, how you evaluate, how you treat, and let's go from there.
Absolutely. Thank you so much for having me. I highly respect you and everything you do, and it's been such a blessing and a pleasure to be able to work with you over the years and your providers. I am in awe of what you're doing and how you're helping so many thousands of people as well. So it is my pleasure to be here, and thank you very much for trusting me and your time. So yes, I have. I'm a board-certified family nurse practitioner, and I specialize in regenerative medicine. I've also taught, as you said, many providers over the years on ultrasound-guided musculoskeletal injections and regenerative medicine. So some of the options that are out there, first and foremost, our goal with practice personally, as well as teaching, is there's definitely time and place for medicine. But when you look at the statistics in this country, there's so much opportunity to be able to help patients and avoid unnecessary medication and avoid unnecessary surgery. And so the fact that I've been a piece in helping so many patients over the years and then teaching providers how to do exactly that has been very fulfilling. And I love the results. It's life-changing for so many patients. Regenerative medicine, is it for everyone? No. But are we able to help a very large population avoid surgery? Absolutely. And so it's quality of life. How are you helping them be able to play with their grandkids, to be able to spend more time with their children, and to do the things that they love doing because it brings them joy and happiness? And the best part is they're using their body to heal their body. And so it's exciting for me, obviously. This is my passion. This is what I love doing. So talking about evaluation, when a patient comes in the office, I love how you guys do such a thorough evaluation. You really look at the big picture. It isn't just the right knee pain. You're looking at the person as a whole. What is their nutrition? What medications are they on? It isn't just the standard medical history. It's looking at the person as a whole, because when I look at a joint injection and I look at regenerative medicine, those are two pieces of this big puzzle. And so you're looking at the joints above, below, the joints opposite. How is it affecting their life? How is it affecting their quality of life? I know in my practice, I really look at what is the driving factor that brought that person in the office, because once they start feeling better and functioning better, that's great. But it really boils down to, how do we retrain this body to function better, not just treat that knee pain, for example. So it's a full, thorough evaluation, including nutrition, everything. I know you guys do a very thorough evaluation. I know your providers all very well, and they do a phenomenal job.
Karen, let me interrupt you for a minute. Let's specifically focus on the joints that you see the majority of the time, which are going to be the knee joints and the hip joints. That's what we see primarily. Now, some people have shoulder joint problem, but the big problems come with the major joints in the lower extremities, and they develop osteoarthritis. Osteo means bone, arthritis means inflammation of the joint. So let's talk about what causes osteoarthritis in individuals, and what percent of the population, let's say over the age of 50 or 60, what percent of the population has joint pain and joint problems, and what caused those problems?
That is so great. And this is part of what I teach when I teach class, is osteoarthritis is extremely common, especially as we age. Age 50, 60, I believe over 70% of people over the age of 60 have some form of breakdown of the joint, which is osteoarthritis. As far as cause, the main theory is wear and tear. So it's just using it for a long time. Things are out of balance. Alignment of the joints are out. There's actually an article that was released a couple years ago, and it showed the two main reasons people develop osteoarthritis is, number one, wear and tear, which we've all known. And the second is actually inflammation. Inflammation on a cellular level is causing different parts of your body to upregulate unhealthy inflammation that's speeding up the breakdown of the cartilage within the actual joint.
And
explain
plays a big role. Yeah, explain the joint and what makes up that joint. Now, if we're talking about the knees or the hips, we're talking about the femur and the tibia and the fibula, and talk about the joint itself. Inside the joint, what's the makeup of the joint? When you talk about cartilage, where does it exist, and what happens to the cartilage when you get osteoarthritis? And by the way, let me make a note. When we talk about wear and tear on the joints, folks, this is the elephant in the room. 75% of the population is overweight, and 40% of the population is obese, and that has a dramatic adverse impact upon your joints. You weren't meant to carry around that much weight, and that is wear and tear on your joints, and this is going to wear them down. So explain to us about the cartilage in the joint and what happens when people develop arthritis of their joints.
Absolutely. Two main areas of the joint is you've actually got the joint capsule itself. Inside the capsule, there's something called cartilage. And cartilage is I always think of it like a cushion. And it's actually there to help the joint to be able to slide and glide smoothly through movement. You've got synovial fluid in that joint as well. So when we see arthritis, there are three things that happen that are actually causing breakdown of the joint with arthritis. You have decreased joint space, and therefore there's less movement for those bones to move around. You're putting more pressure on the cartilage, which is like that cushion or that pillow. And so instead of it gliding smoothly and having that nice cushion, you have less space, and you're decreasing the cartilage in through there. So eventually you're getting to where it's bone on bone, and bone on bone is extremely painful.
Now let me show a quick slide of the right knee, and you can see the narrowing of the joint space, and you can see the inflammation in the joint compared to the left knee. And this is what we see when we do X-ray, just a flat plate X-ray of the joint. This is what we see. Also, we can do MRIs of the joint, and we can even get a better look at an MRI of what's going on in the joint. But anyway, back to what happens when the cartilage is broken down. By the way, I also want to show I've got a photograph of the hip, a flat plate of the right hip, and you can see it compared to the left hip. The degeneration in the joint space as the head of the femur fits into the joint, the acetabular, and it's all broken down. That's what a degenerative hip looks like. In the previous slide, or the previous photo, is what a degenerative knee looks like. Anyway, let's go back to we were talking about the cartilage and the synovial fluid and what happens when the joint breaks down, and it's caused by wear and tear. And I'm here to tell you, folks, if you're not down to an ideal body weight, you're going to wear out your joints. It's going to happen. Now, of course, you may have had an injury earlier in life. That could easily be it. Or you may be a jogger, and you're running all the time, and that is going to take wear and tear on your joints. I don't believe God made us to run on concrete, 5 miles every day. Now, you may have some good tennis shoes. Maybe you can get away with it. But I have seen numerous individuals, including members of my family who are my daughters, who've been out jogging for years and years, and now they've got joint problems, and they're in their 40s. And it's they're running marathons and all that, and it's no surprise, because I've seen this throughout my career. Numerous people that are big joggers, they get joint problems, and that's not to be unexpected.
Yes, I run for 35 years.
How are your joints?
I'm very blessed. I'm actually my joints are in
good shape.
Very good shape.
But you're thin and trim too. Pardon me?
I've been proactive with nutrition, alignment of the joint, like you said, good sneakers, but also I've been very proactive with using these treatments. I don't wait for pain. I know I like to be active, and I have access to things that will help my body so I can do the things that I want to do when I want to do them. So I haven't waited for arthritis and for pain to actually do treatment, knowing that the things I like to do break down, it is wear and tear. So I've just been very proactive on it. Going back to, it's funny, speaking to the choir right here, 35 years of running. Yes. So I can speak from experience firsthand. Absolutely. When we look at arthritis, it's the decreased joint space. You have decreased cartilage, which is really important when you're looking at what are possible treatment options. The other component, decreased synovial fluid, and then bone spurs. As we have more wear and tear, you'll see what look like, they're actually called bone spurs or osteophytes on x-rays. And that's where the bone puts down the body's way to try to help or heal is to protect it by laying down more bone, and that forms a spur. And that is a sign of arthritis. So our goal is to actually slow down the breakdown and help stimulate the body's own healing cascade and healing response. And so there's some really exciting ways that we can actually look at treatment to help slow down the wear and tear and the osteoarthritis. And
now,
I've seen phenomenal success with lots of different patients.
Right.
And to your point, it's knees, hips, and a lot of shoulders. I inject every part of the body, but those are the absolute biggest ones because of what we do.
I want to point out here, when we're talking about regenerative joint therapy, this is different than knee replacement therapy or injections of cortisone into your knee. And I want to contrast the methods that Karen Ray uses, and we use here at the Hotze Health and Wellness Center, with what the normal orthopedist would do. If you go to an orthopedist, tell us what they're normally going to do. If you go in and they say, yeah, you've got degenerative arthritis, they do an x-ray and an MRI, you have degenerative arthritis, you have pain. What's the first thing they offer the patient?
Cortisone injection.
Right. And of course, initially that provides some relief, maybe for a couple of 3 months or 4 months. And then the pain returns and the patient returns to the orthopedist and he goes, well, I have to give you another shot. He gives you another cortisone shot. And that may happen 3 times in the first year and the pain returns. And the cortisone, by the way, doesn't stimulate new joint cartilage production. In fact, it inhibits it. So after 3 or 4 injections over a year or 2, invariably the orthopedist is going to make a recommendation. And guess what the recommendation is going to be?
Surgery, joint replacement.
We're going to give you joint replacement surgery, which is a high-ticket item, by the way. I don't know what it costs, 30, 40, I don't know. It may cost more than that. I'm not sure what the cost is, but it's extremely expensive. And in a certain percentage of the cases, it can be very helpful. I mean, people, if you got bad joints and they're totally worn down, you and I all know people that have had their joint replaced and were very satisfied with the results. But we know that there's a percentage of individuals that have joint replacement surgery that have adverse results. I have a friend of mine, he's had 3 surgeries on the same knee. It got infected the first time, they had to redo it, then they had to replace the joint twice, and he's had 3 different surgeries on the right knee. And I think somewhere in the neighborhood of about 15% of individuals that have joint replacement have some long-term adverse effects with that. So it's not 100% perfect. But my thought is, why would you want to get your knee or your hip amputated or your shoulder amputated for that matter? Why would you want to get it amputated if there's a way to help stimulate first naturally decrease the inflammation in the joint, which is caused by enzymes, catalase, and proteases that are eating away at the cartilage. And if you could do something that would stimulate new cartilage production within the joint, it seems like that alternative would be what you'd want to take. Unfortunately, most people, when they come to see us, and it's probably the same way with you, they've already seen the orthopod, and the orthopod's already told them they need to have hip replacement or knee replacement, and they're coming to you as a last resort. We see that commonly here at our practice, and I'm sure you do too.
Yes, definitely. And they've had friends or family that have both had surgery and had good outcome and bad outcome. And then what is this regenerative medicine thing? What does this mean? What are my options? And so it's a lot of fun to be able to educate patients on what their options are. And my favorite part is using the body to heal the body. Our body is incredible. And when you give it the right tools, what it actually can do is just mind-boggling of what I've seen over the years.
Yes. I always like to tell our guests at our office, and we call our patients guests, that God has given your body amazing restorative powers within itself to heal itself. If you think about it, you go out, fall down, break your arm, you can get put in a cast, it's going to grow back together. You go get in a car wreck and the car doesn't grow back together. You got to go get somebody to do mechanical work on it and do body work on it. It's not going to grow, but our bodies have amazing restorative powers. You put the right molecules in the body and the right nutrition in the body's going to heal itself. And that's the same thing that we use. That's our philosophy when we use regenerative therapy. So let's talk about what's causing the damage in the joint. We said it's osteoarthritis, and let's talk about the enzymes that are tearing down the cartilage, and then what we offer to and what we use in our procedures and our injections to help stop the inflammation, stop the breakdown of the cartilage, and then what we do to stimulate new cartilage production.
Yes, my favorite. So this is exciting for me because I've seen such amazing results for so many patients. So we've done a thorough evaluation. You've got we've done imaging. We've evaluated that, yes, you have breakdown of the joint, osteoarthritis of the joint. And now it's what are the treatment options that are natural and regenerative? My favorite is something called A2M, alpha 2 macroglobulin. And the A2M is actually made in your liver. It's something that your body makes naturally.
It's a
And the
natural.
A2M is,
It's a natural protein your liver makes,
yes,
and it's called a macroglobulin because it's
yes.
globulin. It's a protein. It's macro. It's
Yep.
large, so it can't get in. It because it's so large. It doesn't get into your joints on your own. So let's explain how we get it into the joints.
Yep. So you have the A2M is floating around in the blood, circulating through your body. So it's a simple procedure that we do a blood draw, and then we process it and filter the A2M out using a very specific filter. We centrifuge your blood and we spin out the red blood cells, and then we spin out the platelets and the A2M, the large macroglobulin, and then we filter that A2M out of the platelets. So we've got, it looks like a really beautiful golden yellow honey, thick liquid is what it looks like. And then we use ultrasound guidance for precision, and we deploy that A2M specifically where we want it into that joint capsule using visualization. By doing that, that A2M deactivates the protease, which is stuck in the joint, and the protease is what's breaking down the cartilage. So now we have put A2M into the joint, visually guided for precision, and that A2M will go in and actually break down the protease and stop the cartilage breakdown. So that's stimulating your body's healing process to start. That breakdown of protease allows the body to then excrete it out of the joint and out of the body. So you're stopping the osteoarthritis breakdown, which by doing that, you're decreasing inflammation, decreasing pain. A lot of patients are noticing an improvement within 2 to 3 days
Right.
of having the A2M treatment. And then usually about 4 weeks later, is when we'll look at, okay, do we need to do any further treatment? Where are we at? How severe is the arthritis and how long has it been going on? Are two of the main questions that I use in evaluation.
Now, let's also mention the use of ozone therapy when we do the A2M. Can you explain that?
Yes, I love ozone. It's been around for many years. It started in Europe in the 1960s. So the air we breathe is normally 2 parts gas. When we use ozone, most people think ozone and they have a negative connotation. They think of like the outer layer of the earth. Well, medical grade ozone is different, and it's been around for many years. It's very safe, very effective use. So, what it is we use a medical grade ozone machine with our sterile oxygen, and we pump that sterile oxygen through a medical ozone machine. We mix that with we can mix it with our PRP or our A2M. And once you get that sterile oxygen into what our regular air is that we breathe, it's 3 particles. As soon as we that's what makes ozone. Once we put that into the body, it transitions from 3 parts down to 2 parts. And that actually stimulates your body's own stem cells to an area and the healing process to begin.
So this is what we do with our guests when we treat the joints. We'll inject ozone, and then we follow that up with the A2M therapy. And then, as you mentioned, we follow these individuals, and very frequently within at least the first week, they have substantial decrease in their pain in their joint or joints that we inject. And then we follow them for several weeks to see what kind of improvement they have. If they have very severe joint pain, it may take another round of A2M to get them. We like to get them to about 80% improvement at least before we then do the final treatment. And let's explain what the options are on the final treatment.
So on the final treatment, I like to use a stem cell type of a product. And there's two types, one that can be from your own body, and there are types that can be donated. So if it's a donated product, that's usually it's called a Wharton's jelly product or an HCTP, human cellular tissue product. And that is from the umbilical cord. That is a female that is having a pre-scheduled C-section delivery. They've been fully tested. This is a very highly regulated area and environment for safety reasons. So once they go to their pre-scheduled C-section, the Wharton's jelly, which is the inside, the gelatinous substance that is in the umbilical cord, is harvested and then taken to the lab. Again, fully tested, very rigorous testing. Then once that's prepared and ready, that can be sent out for shipment for use.
And that contains
donated.
That contains hyaluronidase. It contains exosomes, which are the chemical products made by the stem cells, and some stem cells themselves, some umbilical neonatal stem cells from a live birth, a C-section. So that then is injected into the joint. And what is the purpose of that, Karen?
A couple of things. It stimulates your body's own stem cells to the area, significantly decreases pain, inflammation very quickly for many patients. The other thing you pointed out was the hyaluronidase in the donated product. That is actually a human form of hyaluronic acid, and that cushions and lubricates a joint space. So some people will use a synthetic product for they call a rooster comb injection.
Right.
Well, this is a natural human form, and there are very high levels of a donated product that actually have that cushion, that HA, hyaluronic acid in it. So that's a big benefit when you're looking at joint care. So this actually helps stimulate repair and the healing process very quickly when you do your donated product.
So once we've done this procedure, explain to us in your experience, what percent of the patients will have significant improvement? And by the way, folks, it all depends upon the grade of your osteoarthritis or your degenerative joint disease. You can have mild, moderate, or severe. Obviously, the earlier you take care of the problem, the greater you'll have for long-term success. You come in when your knees are down to the bone, you're going to have benefits, but it's not going to be as long-term. You may have to come back in for some follow-up therapy in the next year or the year after that. But still, at the same time, you're not going to have your knees or hips amputated. So tell us, in your experience in treating people with mild and moderate and then severe arthritis, what are the long-term, how do they do long-term, each of those different categories? And how long will it be before they'll need to come back in for a follow-up treatment?
Great questions. Definitely the sooner the better. Be proactive. Why wait for a problem? You love your life. You love things you love to do. Be proactive is the biggest piece of advice I could give. Second, statistically, 80% of patients notice an improvement steadily week to week. There is a small percentage, about 10% that it takes about 3 to 6 months for it to really kick in fully. When it's a more higher moderate arthritis, it can be a good 4 weeks for it to really kick in. The patients that are severe, it can be 5 to 6 months before it kicks in. And then the other thing is boosters. I like to talk to patients about, let's be proactive on this. And whether it's the full treatment every 1 to 2 years, or it's, just an ozone injection, or there's lots of different options. But if it's an osteoarthritis, retreating with the A2M annually has worked out very well for many patients, but it's not a requirement. It's just, what are your treatment goals? What are your quality of life goals? And how severe is the arthritis has a lot to do with that decision making. And make sure to your point, clean up your diet and be at a good weight for your body type, that will take a lot of stress and pressure off those joints.
Well, this has been a very instructive, informative, and enlightening conversation with you, Karen. Again, I congratulate you on your wonderful work and how much you've done to help literally probably hundreds of thousands of patients through the doctors you've trained and the providers you've trained over the years, 3,500 in the last 10 years, plus all that you've treated. You've really had an amazing impact on people's health. And I want to encourage any of you, if you live in the Florida area, go see Karen Ray. She's down in Clearwater, Florida. What's the name of the center?
Bliss Medical, blissmedical.com. Happy to help.
How do you spell that?
Bliss, BLISS, medical.com.
I like that. Bliss Medical. Okay.
You've been blissed. That's our logo.
Blessings. Yeah, you've been blessed.
You've been blissed.
So, and if you live in the greater Houston area or somewhere in Texas and you're having joint problems, then it would be a privilege for us to have an opportunity to evaluate you and treat you if it's indicated. So don't hesitate to give us a call here at the Hotze Health and Wellness Center. Karen, again, thank you for joining us today, and thank you for your great work. We appreciate you, and thank all of you all for joining us today. We've enjoyed being with you. God bless you.
Did you know that pharmacists are considered the most accessible healthcare professionals, and yet at the same time we are generally the most underutilized? Pharmacists are medication experts, which means that we can best advise you on the safe and appropriate use of your medications, when to take them and how to take them. We're experts in pharmacology, which means that we receive extensive training to understand the science behind how medications work within the body. We screen for any interactions which may occur between the medications you're taking, and we have an in-depth understanding of how these medications affect each system of the body. Your body is unique, which means that the type and dose of medication you take should also be unique. We want you to know that at Physician's Preference Pharmacy, we are always available to you, and we welcome your questions.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.